engineer at core. I have been a co-inventor of four filed patents, author of 6 international publications, and an independent author of a book on electronics and communication engineering, which is sold worldwide since a few years. Coming to the company, and I am also joined by my wife. She's the co-founder of the company too. She's also an engineer and an alumnus of IIT Madras and IIM Ahmedabad. The company is around 2.5 years old. It's a medical device company, and we build smart devices for physiotherapy and rehabilitation. And our flagship product, Fizi, is already in the market. So, with this quick introduction, I would like to kickstart the webinar with lots of interesting points that are there to discuss, which are aimed to enlighten the audience with more information regarding the recent trends in physiotherapy, with focus on home health. Dr. Madhuri, with this, we would love to start off the presentation. A quick word from your end, and how would you love us to start the thing? And post which, I have a few interesting questions in my mind, which I would like to share with you. And please enlighten us with your experience, ma'am. Over to you.
Sure. Thank you, Suresh. Thanks for the introduction and thanks for this opportunity. Actually, I feel very honored to talk about this topic, about the trends in physiotherapy. Basically, as with any profession, there have been huge advancements in physiotherapy too. Usually, with any profession, there are advancements based upon the technical devices or the tools available at that time, and physiotherapy is not an exception in that case. So. We had a very humble start. Physiotherapy as a profession had a very humble start. And before we get into the current trends and upcoming trends in physiotherapy, let's have a very brief look at what the profession was, just to emphasize how much change we have been and how much distance, how long we have come since we started. So I just have a very short, small presentation, and I would want to start with that presentation now.
Sure, please.
So physiotherapy, as everybody knows and is aware, is everything and anything to do not only with the movement, enhancing the movement, but also and also maximizing the physical potential and the activity potential of the patients. So most of the physiotherapists, they use the physical agents and like heat, cold, electrical modalities, and lots of exercise to not only to promote the mobility but also to restore mobility. So, physiotherapy as a profession, it started way back in 1813, where it was not called as physiotherapy, but it was called, started by a gymnast in Sweden. So, it was only in the World War One or post World War One, there was a group of people who were identified, especially to help with the people who were wounded in the war, and they were called as reconstruction aids. There were a lot of changes at that time too, in recognizing the therapy that these people do, and lots of courses which were added. And finally, there was an association which was formed, which was called as the American Physical Therapy Association in 1930, and it was only identified as an independent profession by 1954. That was in the world scenario where it was identified as a profession and people came aware of that. But India had its roots in physical therapy in the form of Ayurveda and the massages and the exercises as in yoga for a long time. But it was identified and included as a health profession only in 1952, when we had a polio epidemic, and lots of people were required to help with the rehabilitation of these patients. And a formal association for in India for the physiotherapists was formed in 1967, which was called as the Indian Association of Physiotherapy. So at that time, the modalities which were used and the treatment concepts which were used was very, very limited. It was only limited to massage, some traction, and very few exercises, and there was no regulatory body as such at the time. So compared to that, which was in 1960 to now, what we are, what physiotherapy profession is as of now, is it's very much changed, and so many concepts have been included. Not only the scope of practice has improved, but also the concepts in the treatment and the interventions have also increased. So, physiotherapy, as of now, as of today, is an integral part, an essential part of the rehabilitation in every department and every part of the healthcare delivery system. So, physiotherapists practice not only in hospitals and outpatient clinics, they also have specialized, we as of today have specialized inpatient rehab facilities where the patient admits into the hospital or the rehab facility exclusively for physiotherapy, occupational speech, so that the recovery is accelerated. So apart from this, there is home care, of course, and which are all of these are basically clinical and therapeutic post a condition, to rehabilitate post a condition. Apart from this, we do have physiotherapy which is done preventively and to improve the performance, as in sports centers, schools, offices, as in ergonomics and wellness centers, etc.
Okay.
So there have been a lot of technical advancements as of today. Also, physiotherapists use a lot of technology, not only in terms of order management, reaching out to the patient and everything, but there are like huge equipments like the locomats, the assisted gait training, which is called as the light gait, specialized gait analysis labs, etc. So, and there is already good quality of evidence available, literature after the research for all the conditions and the interventions which are being followed by the physiotherapists. So, which is actually researched and proven that these kind of therapies does help a patient recover faster and better. And in terms of regulatory environment too, not only the clinical aspect of it, we do have internationally the World Confederation of Physical Therapy. At a national level, we have the Indian Association of Physiotherapy, which has always been supportive and helping the profession to grow. But recently, we have an exciting change here also, where the National Medical Commission for Allied Health Services is formed. The bill is just passed, and there are yet to announce so many changes in the regulatory environment of the profession. And at
Okay.
state levels too, we have some state councils of physiotherapy, all of which to help the growth of the profession, not only in terms of practice, but also in terms of improving the education and standard of training. So here comes the topic, which is the upcoming trends in physiotherapy. So what's coming is very exciting and very technology oriented is what I feel.
Okay.
So most of the people around the world, I think in Australia too, there have been lots of technological advancements, and around the world, people already are using these kind of technical advancements, but they are yet to come into the mainstream.
Mhm.
In India, like these remote monitoring tools, teleconsultations are already going on because of this, not only because of the COVID situation. It was actually started way back in 2017 to see
Okay.
the effectiveness of teleconsultations. And the robot augmented exoskeletons have been researching, and AI assisted not only diagnosis but also with which helps in the interventions is
Okay.
also included. So, just to emphasize or to see this kind of development in technology, I came across one of a very interesting clip made by the Australian Physical Therapy Council. So I'll just play it and
Sure. Sure. Please. Can you please share the video? It's not.
Yes.
Dr. Madhuri, we are not able to see the video. Maybe you'll have to minimize your screen and then just share your video screen.
Okay.
Dr. Madhuri, we are not able to hear you. Sorry. I think there's a small technical glitch. We'll just wait for a few minutes for Dr. Madhuri to join. In the meantime, if anyone has any questions, you can please feel free to drop in the chat box. We'll be very glad to answer.
Hi, can you hear me now?
Yeah. Yes, we are. Yeah.
Yeah. So we had a power cut, so I'm really
Okay.
sorry about that.
Sure.
So
No,
we
no.
can we don't have the video, but then that is almost the end of the presentation. Probably we
Awesome.
can take the questions right now.
Yes. Yeah. In the meantime, I also requested the audience to put their questions in the chat box. By the end
Sure.
of our discussion, maybe we can also answer the queries. Yeah.
Yeah.
So, Dr. Madhuri, I have a few burning questions in my mind. And thank you so much for taking us throughout the journey of how physiotherapy and rehabilitation evolved, in almost a century. It was great. That was almost new to me. I'm sure many other physiotherapists will really like it. So I have from the pictures that you saw, we see that there's a huge transformation that has happened from the time it started in the 19th century, 1800, to now, 2020. And as you rightly said, I also see, being in this industry, I also see that a lot of technology is now coming up from telemedicine front, and new technologies like robotic assistive devices. So thanks for sharing the entire view of that. So with this, and since you also brought the COVID situation into picture, and also the scenario without the COVID, I just wanted to understand from you, how do you see the home physiotherapy in India and also abroad? How do you see this area, moving forward in the coming years? The size of the market and the importance of home physiotherapy. So can you please throw some light in that regard?
Sure. Home physiotherapy has always been a very important part of physiotherapy, not just now, but even before. Um, it may not be because of the COVID situation or anything, but then all the patients for suffering with any condition, based upon their request and the condition and convenience, they used to request for a home physio, and the home physio has always been there. However, in other countries, the insurance covering the home physio has started relatively recently. So that has improved in the other countries too. So here in India, we don't have, as of yet, so many home physiotherapy visits getting covered in any of the insurance yet, or some of them have, which barely have it. So that is one of the change which has happened because of the insurance model, which has been growing actually, home physiotherapy, but it's been always there.
Great. So right now, the home physiotherapy is still about sending the physiotherapist to the home and having the treatment. but there's a good need, is what I see from your this thing. There's a good need that the patients need some more care even after they leave the physiotherapy clinic or the rehabilitation center.
That is true. Yes.
Okay. So one important thing as a follow-up question I have, uh, there are some challenges when you have the physiotherapist going to the home and doing the helping the patients to physiotherapy. There are a few challenges, and considering the COVID thing that has happened right now with social distancing and all, how do you see it impacts what are the major challenges considering the pre-COVID and the post-COVID from the home physiotherapy front? Do you see any additional challenges that come into picture from social distancing front and various other challenges that are happening? Lack of transportation. So, how do you feel? What is the challenge? Biggest challenge that you see?
Sure, Suresh. Before we get into the challenges, I do want to add one point for the advantages of home physiotherapy.
Okay.
For any of the most of the conditions, about 90% of the conditions, physiotherapy usually is a long term process and takes about a week or 10 days, on an average, about 10 days of 10 sessions of therapy.
Okay.
So, in a home setting, in a home care, usually the patient following all of the therapy, because the physio themselves are visiting the home, is much better, as in the clinic when the patient is not feeling well and somebody has to bring them to the therapy room. So the number of sessions they miss is more. So at home, I think that is reduced, and that is a plus point, is what I call. And coming to the challenges, definitely there are challenges when coming to when the physio is coming and doing the therapy at home. For example, the patient might be distracted with the things going on at home. They might not be ready. Sometimes they
Okay.
make the therapist wait. They are not completely ready for the therapy session to be going on. And all the possible equipments may or may not be available.
Available. Very true.
Sometimes, yeah, sometimes there are space requirements. Sometimes some of the activities cannot be performed at home, like if there are some steps which need to be practiced that may or may not be done, things like that. And in some of the conditions, like some huge equipment, like as I was mentioning about the light gate, those things may not, or a hydrotherapy pool, they may or may not be available.
Very true. Okay.
So those are the challenges that physios do come across.
Okay.
And how the physios handle that is by, of course, improvising and using whatever is available at the patient's place, but somehow completing the therapy. And the advantage of this being, the patient is actually used to their own environment. So if there is a particular a step up that we need to practice, they will practice that in their own environment, which they are very comfortable at. So there are both advantages and disadvantages.
Okay. So coming to the COVID part, the second part of the question was, how do I see that there are already a good number of challenges in home physiotherapy. Now, how do you think, as you are on the field and you know the situations there, how do you feel COVID is impacting this? The social distancing norm, which is a new norm for coming years, definitely, for sure. So how do you see, Dr. Madhuri, that it is impacting as a greater in a greater way? Do you see?
Yeah, the social distancing and, of course, the lockdown has impacted almost all the businesses everywhere, as everyone is well aware. But physio, because it is very much a one-on-one, and it involves a lot of contact in some of the patients. Actually, the impact was many patients did not opt for the therapy for some time because of precautions. And everything. But then how we are, that being a new normal, doing a home visit, I'm talking about, doing a home visit, the physios are adapting by, of course, following all the precautions and making patient aware of the precautions they're supposed to be taking, things like that. Yeah.
So with that, the work is progressing forward. Huh? The patients are okay with that.
To progress.
That's awesome.
Yes.
That's very good news. Okay, that's good to hear that things are moving ahead post-COVID now. You have a great experience both working in India and working abroad, studying abroad, seeing different cultures, working with different kinds of patients, working with different colleagues in your domain. So, can you point out a few differences, maybe some pros, some cons, from the behavioral front, from the technology front, from the way physiotherapy is conducted abroad and here, how it is received by people. Can you please throw some light, and any improvements that can be done here? Can you please throw some light on that?
Sure. I believe the major difference in patients, I think it is different. It is divided into two. One is the culture.
Mm-hmm.
Culture, as in how they see disability as,
Mm-hmm.
or any ailment, any physical or mental condition that they're having, how they see it as. In the I cannot really comment upon the other countries, but at least in the US, people take responsibility of their own health. For example, let's say a physical ailment. Here, the good thing, which I really appreciate, is we have a lot of family, and even in nuclear families, if somebody is not well, the family comes, the friends are there to help out, and which is great about the culture that we have. But
Okay.
then the person, they themselves taking responsibility of their own health is what is different. Here, if there is a long term disability or something of that kind, like let's say a person has suffered an amputation, here the person is out of the workforce for good. They don't plan to, or even if they have opportunities, they don't strive to get into the main workforce back again. And most of the times, I'm saying most, I'm not saying that everyone is like that.
Yeah.
Most of the time, the family is okay with that, and the person themselves are okay with that. Of course, they get all the
Okay.
treatment, but then that
Uh-huh.
demand to become independent is
Mm.
not as huge as it is there in the US.
Mm.
In US too, I think in other countries too, the families are there to support, family, friends, everyone supports, but then the patient gets back to their own life, even with the help of using the technology or the aids and things like that, and they are back to their being independent and a contributing member of the community. The second part, I think, is the affordability.
Correct.
There, because of the insurances,
Yeah.
almost everybody is covered.
Okay.
However, I don't. I mean, I am not may or may not be the supporter of the insurance and the healthcare system,
Mhm.
but still, everybody is covered somehow. And
Okay.
if somebody needs a particular kind of therapy, it is they are it is available for them.
Okay.
So there are some premium insurances which
Mhm.
cover, some of them may or may not, but then everybody gets the basic treatment what is required, which may or may not happen in India because it is completely dependent on how much the particular patient can afford. Like to go to a particular hi-fi facility, of
Mhm.
course they need to spend. And I want to add one more point. There is a third point that, like, let's say an elderly person suffers a stroke or something.
Mhm.
And usually they do get all the treatment, they undergo
Mhm.
the rehab and everything. But
Yes.
usually, if the person is able to walk
Mhm.
with a walker or a stick,
Mhm.
or if they're walking independently, also,
Mhm.
that is good, and the family is happy, they themselves are happy. Even
Okay.
if the person is having like a little bit of a foot drop, which usually
Mhm.
happens, some of them, which usually happens to take some time,
Mhm.
they are okay. They say that they're able to do their work.
Okay.
They're having a foot drop. That means they're just dragging the foot and
Mhm.
walking.
Mhm.
They're okay. They're saying anyway, I'm able to walk. This is fine. They're
Okay.
okay with that. But
Mhm.
it's not okay. In the US, definitely it's not okay. They have the treatment. They take the treatment the
Mhm.
entire time. And if
Mhm.
there is a way to get it better,
Mhm.
they will take the treatment and make it better. They will follow it up, follow it through, and make it happen. So that is the major difference, is what I feel.
Okay. So does the cost play the cost of treatment is that one of the barriers why these people are not continuing even after reaching a certain level of recovery? Do you think that's one of the concerns here?
In
Because they might
India,
have already paid, yeah, in India. Yeah, yeah. See, as you said, in the other countries, especially in the US that you have seen, you say that the person, after he or she is ready to walk, even if they're walking a bit, but still they continue the treatment and ensure that their day-to-day functional activities. But
Yes.
here they are satisfied, is what I understand. Please correct me if I'm wrong. They're satisfied with the little bit of treatment that has happened, and they're able to stand and walk slowly. They're okay with it. So my question is, the query is it that they're not continuing the remaining treatment because of the bills or because of lack of insurance? Is that a barrier?
That may be one of the factors, yes.
Okay.
I'm assuming. Yeah.
Okay, fine. And just a follow up to your to the explanation that you gave, you in your presentation you also talked about the regulatory things that are improving, on a day to day basis, even in a country like ours.
Right.
So, do you see any policy changes that might be on the roll, which are aimed towards making this area of healthcare also fit into the insurance part? Do you see anything happening in that way from the regulatory front, from a policy level? Or it,
Definitely, it is coming.
okay,
Yeah.
okay, okay,
Mhm.
okay, okay.
And there has been huge changes in taking the responsibility of their own health, and the
Mm-hmm.
patient self-monitoring tools
Mm-hmm.
have come into the market, and has been a huge hit. Not only
Okay.
um, um, not only that they improve the efficiency of
Mm-hmm.
the therapist,
Mm-hmm.
because they don't have to be there all the time, and they can monitor it, remote monitoring devices which help them to monitor it remotely.
Mm-hmm.
It also helps them to actually increase the efficiency of the exercise itself,
Mm-hmm.
because the patient will be able to see where they're going wrong, and if they are able to complete the exact movement that the physio is given to them through
Mm-hmm.
those devices. Definitely, I see that is an added value, and physios are already using them. Some of them.
Okay, okay. So, as a new norm that is coming up, because of the social distancing and this COVID thing, I'm quite worried about that because, as you rightly mentioned, during physiotherapy session and rehabilitation sessions, physiotherapist and the patients are quite close to each other, helping do the exercises and also communicating. So, do you see any differences that have to come up in the infrastructure from the infrastructure front of the existing clinics that many physiotherapists will be having, or from the hospitals front? Do you see any infrastructural changes that are needed to to follow the new norm that will be there for a few years to come? So, as compared to the traditional physiotherapy center or the rehabilitation center, do you foresee any structural changes or infrastructural changes
Like clinic, you mean?
in a clinic or in a rehabilitation center, considering
Um,
those things? Yeah.
as we were talking about these self-monitoring tools,
Okay.
these tools and devices can be used in a clinic too.
Okay.
Of course, most of the devices that the physiotherapists are using are
Mhm.
the mobile ones, and
Mhm.
they can be used not only in the clinic, of course,
Mhm.
taken back home. So,
Mhm.
except for the huge equipment additions in the clinic,
Mhm.
or the infrastructure, I think everything is mobile, which is actually taken to the patient's house, and used
Okay.
in home
Yeah.
care.
Great, great. So I think technology is playing a good role from the physiotherapist front as well as from the patient front. One last but very important question that I have is how, since physiotherapy and telemedicine, and obviously telephysiotherapy is the new norm, which will help both the physiotherapists and the patients. What kind of challenges do you see from the education front? Do you see that people are ready, the patients are ready to adapt technology to help them do physiotherapy remotely? And do you see, and what is the mindset of the current physiotherapists who are practicing physiotherapy, in a strict way? They have different methods of their own. But how do you see the acceptability and things which are a mandate to get into working with the new norm?
I think that, according to me, people are surprisingly very accepting of the new technology. People are ready to take whatever is like technology. When we use a new device, or when we introduce to the patient, it depends upon the physio how they are introducing it.
Okay.
If it is an elderly patient,
Mhm.
sometimes that method of introduction might be just giving them some time. So if we can explain the advantages, the reason why it is used and how it is done, and then if required, given some time, they are quite accepting, is what I feel. And telemedicine as of now for the physiotherapy is a relatively very new and drastic thing for the patients to accept. But then I believe that explained well, and not all the sessions, but some of the sessions, when explained well, the patients will accept. And when they do look at the results and the benefits that therapy, continuing the therapy is giving them, I think they'll be even more acceptable. In fact, I just want to add, there was one study which was done way back in 2017 itself, even before all this COVID situation, for teleconsultation in physiotherapy. So basically, they wanted to do this study to reach out to more of the remote places and the rural places where the physiotherapist was not able to reach. So this study was conducted for a rural area in Nepal. And the physiotherapist has assessed them and given a care plan through teleconsultation. And they wanted to check the actual efficacy, if it was actually effective for their pain condition. And actually, it did about, and they did conclude that it is effective 70 to 80%. There was reduction in pain, there was improvement in the symptoms, etc.
Okay, awesome. Okay, just since you talked about Nepal, just a quick question, clicked my mind. So there are a lot of rural areas, a lot of villages in our country. So how do you see the patient to physiotherapist ratio? I just want to know the statistics in India, how tight it is or how well it is. And as an upcoming trend, I think telephysiotherapy can play a huge role connecting to the rural segments. So is there a shortage of physiotherapy? How is it right now in India?
We do say that there are a lot of colleges coming. There are so many physiotherapists available and everything. But still, according to the WHO, for every 10,000 people in a population, one physiotherapist is required. But in India, we do not have so many qualified and registered practicing physiotherapists for the population we have, leave alone the rural areas, but even in the urban cities, we are not able to meet that ratio. Basically, so there is definitely a shortage. There is a workforce projection which was done in US basically, and there is a shortage in that is yet to come, and I'm looking forward for it. Now that we have allied health science coming in, we are going to have all of that in place. That definitely is going to add to the value of the profession. Yes. Awesome. The second question you asked was?
Second question is also for telemedicine in India. Can we get the guidelines in writing if these are already in place?
Yes, most of the guidelines which were given by internationally were around were actually set, and also the privacy. Okay, and here in India we're not. I wouldn't say we are not. We are following the privacy guidelines and everything for the patient, but IAP definitely has given out some guidelines, and we can follow it. We can find it in the IAP website for the lockdown. Yeah.
Okay. Okay. For telemedicine too.
Yes.
Okay. Kalpana, I think Dr. Madhuri has answered the question. I hope that has helped you. Any more questions from the audience? We'll be happy to answer.
Hello, sir.
Hi, Kalpana.
Am I audible?
Yeah, Kalpana. Yes, please.
For your view, ma'am. I have gone through the IEP guidelines, but I think that they have written is for about the OPDs and IPDs. Perhaps I could not find the guidelines for telemedicine as of now. But if you're saying so, maybe I will again search and see if they are there. And if you have a ready access, if you can just share the link, if it's possible, ma'am.
Sure. Actually, the saying is around the guidelines are around the privacy of the patient, which is a huge thing in the other countries following the HIPAA rules and everything, where there is a video consultation. The privacy of the health information of the patient is not supposed to be revealed to anyone else other than the treating physiotherapist. So one is around that, around the safety principles of the patient, how you determine the safety of the patient when the physio is not being present one on one, and how you're making them actually do these particular kind of exercises. So it is up to the therapist to determine who is the right fit for a teleconsultation. So those are the major, that is the summary of the guidelines given in Canadian Council, but other countries which are following the tele consultation.
Yeah, yeah. So Kalpana is requesting for any information in that regard. If
Sure.
ma'am, if anything is available publicly over any website, either of, I think that will guide Kalpana in a good way.
Definitely.
Thanks,
Yeah.
Kalpana, for asking the question. I think.
Thanks for your valuable time, sir. Have a pleasure.
Yeah, yeah. Dr. Ashwin is also online. Dr. Ashwin, do you have any queries? Anyways, okay. Fine. It was great, ma'am. Great talking to you. And I'm sure this was very useful for a lot of audience who is available online right now. But also, we'll be sharing this video over Facebook, YouTube. You know, we will clipping it as small snippets, and we'll be publishing it. I'm sure this information that you shared with us will be accessible to a lot of people who might see our website or look for us and get a lot of useful insights to physiotherapy with focus on telemedicine and home health.
Sure. It was a pleasure, Suresh.
Yeah. I'm very thankful to you on behalf of my we would see good synergies for. Thank you so much.